According to the American Thoracic Society, pneumonia is the world's leading cause of death among children, accounting for 16% of all deaths of children under 5 years old, killing approximately 2,400 children a day in year 2015. There are 120 million episodes of pneumonia per year in children under 5. About 1 million adults in the US seek care in hospital due to pneumonia every year, and 50,000 died from this disease. Half of all non-immunocompromised adults hospitalized for severe pneumonia are younger adults ages 18 to 57. Pneumonia is the most common cause of hospital admissions other than women giving birth. I picked this topic because I was diagnosed with pneumonia and still suffering from its symptoms, and this infection should not be neglected. Pneumonia is an infection and inflammation of the lung parenchyma, the lung tissue itself. There are two main ways on how we acquire this infection and inflammation. This is via inhalation and aspiration. Inhalation is mostly pathogens, mostly bacterials, and aspiration. As we experience, sometimes we eat and food goes down to the wrong pipe, and we have this defense mechanism that the pulmonary system provide us that lead us to immediately cough. And as I mentioned, we do have what is called the defense mechanism. I would like to mention the first one, which is the mucociliary escalator. We have the cilia, which is the little cytoplasmic extension that help us to be able to beat the mucus and large bacteria upward so we can spit out or cough out. And the tissue that is commonly within the respiratory system is the PCCE, or the pseudostratified ciliated columnar epithelial tissue. Now, for some people that smoke, there will be some sort of defects or damage on that tissue and that cilia, and they are not able to beat that bacteria. That means more bacteria is going to colonize, which is lead to more tissue damage, inflammation, and infection. The second one will be the cough reflex, as I mentioned earlier, which is activated whenever there are irritant receptors within the actual bronchi. When they are activated, they send afferent fibers via the vagus nerve to the respiratory center in the medulla that activates the efferent fibers of the intercostal nerves and phrenic nerves that trigger the cough reflex. However, some substances inhibit the cough reflex, such as the use of opioid analgesics, hydrocodone, fentanyl, morphine, anti-cough medication, sedatives, and even alcohol. The third one will be the antibodies called the IgA, which is part of our mucosal immunity. And the fourth defense will be the alveolar macrophages, which is part of the normal pulmonary defenses. This is very important to be able to phagocytose to fight the foreign matter. In response to that, it secretes cytokines that pull in other immune system cells via chemotaxis to come and break down those bacteria, as well trigger inflammatory responses. And this is also can be damaged by excessive alcohol consumption and also smoking. And now sometimes, even though there's no defects or damage in this defense mechanism, sometimes the bacteria is just so strong and dangerous and can still attack and cause damages. The bacteria release a bunch of toxins called the endotoxins and starts damaging the tissues. When these tissues are damaged, there is a chemicals that's being released. One of them is the leukotrienes B4. This is very important because leukotrienes B4 moves to the circulatory system and acts as the chemotactic agent. What does that mean? Is when the chemicals draws WBC or white blood cells and other immune system structures into that area where infection and inflammation are occurring. And the other one is the leukotriene C4, D4, and E4. What they do is bind onto the endothelial cells that increase the capillary permeability. That allows liquid to pass through. And when fluids start leaking out, we start experiencing inflammation called the edema. It is also activates mast cells that produce important chemicals called histamines that act on the blood vessels and cause them to dilate and increase the vascular permeability, meaning more blood flow that brings white blood cells and complement protein to fight off those bacteria, which is actually a good thing, but also starts causing what we know, the pneumonia. The leukotrienes C4, D4, and E4 also bind onto the respiratory smooth muscles cause the patient to constrict. That can cause bronchospasm, which is going to cause symptoms like dyspnea or shortness of breath. Now, the macrophages try to engulf and fight that bacteria and cause them to release chemotactic factors that cause white blood cells to come to fight that bacteria and continue to increase more inflammation. Chemical cytokines such as interleukin 1, tumor necrotic factor alpha, they're very important because it helps increase the vascular permeability. However, they also induce pyrexia or the fever. Another chemical is interleukin 8 that act as a chemotactic agent. Besides from fever, you will also experience symptoms like congestion. This is due to the inflammation, vascular permeability, and vasodilation causing alveolar exudate. That means a lot of fluids leak into the alveoli. Congestion is the first stage of pneumonia, which is usually experienced on days 1 and 2. Red hepatization, which is usually experienced on days 3 and 4, this is when the alveolar exudate with white blood cells, red blood cells, and fibrin. When the pulmonary capillaries become so damaged, the RBC starts leaking into the area that can lead to dyspnea, which can lead to shortness of breath or for ventilation, which can increase your heart rate, respiratory rate, and also can induce tachycardia, tachypnea. You may also experience some other extra pulmonary symptoms like fatigue. Gray hepatization that is usually experienced on day 4 to 7 is when your RBC is getting destroyed. The fourth stage will be the lobular pneumonia that can cause symptoms such as chest pain and breathing. This stage should lead to resolution, which is usually experienced on day 8 and more. What will you experience here is the breakdown and clearing of gray hepatization, the RBC, the white blood cells, and the fibrin. Some of it will be broken down completely. However, some of it will actually get coughed up, and this is the sputum on your cough. This is what you see in the patients with productive cough, and this is one important sign or symptoms of pneumonia. There are also atypical symptoms of pneumonia that present extrapulmonary symptoms like headache, nausea, vomiting, diarrhea, severe fatigue, malaise, myalgia, muscle pain, low-grade fever, and this one is opposite with a cough. This one is dry cough. Okay, so I just covered the pathophysiology of pneumonia and its symptoms. We will now move to the cause of pneumonia. There are 3 causes of pneumonia: bacterial, viral, and fungal. Pneumonia is commonly caused by bacterial infection. Usually 75 to 80% of pneumonia is of bacterial origin. The most common one is strep pneumoniae. This is a gram-positive, 65%, usually a community-acquired pneumonia. Second one will be Haemophilus. This is a gram bacterium. This is common in patients with underlying pulmonary disease such as asthma, COPD, cystic fibrosis. Mycoplasma, chlamydial pneumoniae, Legionella, Klebsiella. This is common in individuals who are aspirators, individuals who are immunocompromised, such as HIV, AIDS, or abnormality of the respiratory system such as cystic fibrosis. And Staph aureus, this bacterium is very dangerous, particularly if it is methicillin resistant. Other cause of pneumonia is viral. RSV, which is more common in infants and young children, influenza, which is common in adults, cytomegalovirus, and the varicella zoster, which is the pretty severe one. The last one will be the fungal. Pneumocystis is very serious and common in people with immunosuppressive disease and taking immunosuppressive drugs. The other one will be the histoplasmosis. We can also acquire pneumonia in different settings, such as community-acquired pneumonia. That is acquired in a community or staying in the hospital less than 2 days or 48 hours. Particular bacteria that is most common is strep pneumoniae. Hospital-acquired pneumonia, acquired in a hospital and hospital stays greater than 2 days, this is quite dangerous because pathogens can pass on and you can have a high chance of developing multi-drug resistance. 2 other types are not very common. These are ventilator-acquired pneumonia and healthcare-associated pneumonia. This is common in people that are in long-term facilities like nursing home. The diagnosis for pneumonia will start with a doctor's evaluation, such as asking for medical history, physical exam, and listening to the lungs to check for abnormal bubbling or crackling sounds that suggest pneumonia. If pneumonia is suspected, your doctor may recommend getting blood tests, chest x-ray, pulse oximetry, sputum tests. Now, if you're older than age 65 with serious symptoms and health condition, the doctor can require orders such as chest CT scan if your pneumonia isn't clearing as quickly as expected, and also pleural fluid culture. A fluid sample is taken by putting a needle between your ribs from the pleural area and analyzed to help determine the type of infection. Hospitalization is also required if a patient is older than 65 and experiencing confusion, decline of kidney function, if blood pressure is below 90/60 with rapid breathing, if the temperature is below normal, and if heart rate is below 50 or above 100. Hospitalization is also required for children if they are younger than 2 months old, they are lethargic, they have trouble breathing, they have low blood oxygen levels, they appear dehydrated. Treatment is depending on the type of the pneumonia you have. Most of the time, pneumonia is treated at home, but severe cases may be treated in the hospital. Antibiotics are used for bacterial pneumonia. Antibiotics may also speed recovery from mycoplasma pneumonia in some special cases and can also help with inflammation. Most viral pneumonia doesn't have a specific treatment. They usually get better on their own. Other treatments may include eating food rich in vitamins, especially vitamin C, increasing fluid intake, getting rest, oxygen therapy, pain and fever control medication, and maybe cough relief for severe coughs. According to World Health Organization, pneumonia can be prevented by healthy habits and eating a balanced diet. Adequate nutrition is a key in improving our natural defense. Getting enough rest, exercising regularly, avoiding smoking, avoiding exposure to harmful chemicals or pollution, and also getting the pneumonia vaccine. Hand washing. Washing your hands is the best way to avoid transferring this organism into your respiratory system. And lastly, avoid exposure to people who are ill. We know that pneumonia cases are on the rise, most especially during this time of COVID pandemic, thanks to the group of people who are continuing to study and find answers to fight this opportunistic pneumonia. Researchers from Karolinska Institute in Sweden reports that a recently discovered inflammatory mediator interleukin-26 appears to have an important role in pneumonia and contribute to the killing of the bacteria. Researchers explain that this inflammatory mediator is critically involved in bacterial pneumonia in humans. IL-26 has emerged as an important player in the so-called innate immune response, our first lines of defense against pathogens. It is abundant in the airways of healthy humans, and bacterial exposure stimulates an increased release of IL-26 by lung cells and white blood cells. Interleukin-26 is the most recently identified member of the IL-20 cytokine subfamily. As we learned in the class, that cytokines are primarily produced by leukocytes and act of the epithelial tissue to enhance epithelial innate immunity. The IL-26 is a novel mediator of inflammation, overexpressed and activated or transformed T cells. Novel properties have recently been assigned to IL-26 owing to its conventional cationic and amphipathic features. IL-26 binds to DNA released from damaged cells, and as a carrier molecule for extracellular DNA, links DNA to inflammation. This observation suggests that IL-26 may act both as a driver and an effector of inflammation. Today, I shared with you my topic, pneumonia, the causes and the symptoms of these diseases. I explained the pathophysiology, the diagnostics, procedures, treatment, and its recent research study. Pneumonia is an opportunistic infection that can be severe and life-threatening and should not be neglected. There are ways to prevent diseases such as eating healthy, exercising, managing stress, and living with joy. And this has to start with us. Thank you so much.